लेकिन स्टार्ट, हाँ नहीं, आप स्क्रीन स्विच, हाँ आप कर सकते हो। आप तब, जब तक मैं दिखा इनवाइट नहीं करूँगा तब तक सिद्धार्थ भाई दिखाई नहीं देंगे। माइक चालू है ना?
सर पहले तुम क्या करते?
पर ये स्क्रीन चालू नहीं है।
ये स्क्रीन चालू नहीं है सर, स्लाइड चाहिए।
अभी स्लाइड नहीं है ना।
अच्छा, ये स्क्रीन चालू नहीं है।
क्या हुआ? हाँ हाँ, जब लॉन्च के टाइम पे, हाँ
आवाज येतोय तुमचा। म्यूट करा, म्यूट।
हाँ, एक बार
हेलो। हेलो।
Yes, sir. You are
When
audible
we
to us.
starting? What time are we starting? It's already 8:50.
Sir, just give us 1 minute. We are just waiting for our team to join.
Arvind,
Yes, sir.
there are one parallel meeting also we have to attend. Start from 9:30. Okay.
Got it, sir.
Yeah. So please ensure that meeting should start on time. Now we already lose about 20 minutes by sitting here.
Arvind, if the meeting was scheduled at 8:30, why is your team joining 20 minutes late?
Sir, 8:45 को start. We were supposed to start by 8:45. That is what has been communicated, right?
Agenda 8:30 का है.
सर 8:30 से फील्ड को ज्वाइन करने के लिए हमने ये किया था ना, आप बताया तो ऑलरेडी बात हुई थी अपनी इस पे. आपने
ठीक
बोला
है,
था
जल्दी स्टार्ट
8:45
करो
से.
without any wasting any time. Please start.
ठीक है, डन. कैन वी स्टार्ट? सो सिद्धार्थ भाई, अभी टाइम कट करेंगे, फटाफट इनको दे देंगे. हाँ, डन. So good morning everyone. So it's an absolute pleasure to welcome you all for this much anticipated launch, and we all know what it is. Yes, the launch of Travesite PF, the much awaited brand for our team eye care. And when we talk about Travesite PF, there are many things to share, and definitely one by one we'll be revealing in this today's course of time. But yes, it really matters a lot, because Travesite PF will not only add value to our division, but also to the life of those patients who are suffering from glaucoma. Okay, because that is one drug which is going to benefit not only in terms of therapy adherence, taking care of the IOP lowering part, but also helping these glaucoma patients so that they continue their treatment and actually live a better quality of life. So on behalf of Alembic, I welcome you all for this much awaited launch of Travesite PF, and I am pretty sure you all are very much excited and very much happy to know what all things we have in this bucket to offer you for Travesite PF, so that we not only create a mega launch, we don't only create a brand, but also we create a history in the eye care team, because Travesite PF is going to change the lives of glaucoma patients. Today on board, I have the entire team of eye care who will be coming like in the part of time. But before I start, let us have the opportunity to welcome Siddharth ji, who is already here, who will be sharing his valuable words, and post which we'll be starting with the day's presentation. Siddharth ji, over to you.
Thank you, Arun bhai. Good morning, team, once again. Though it's a kind of a one-way session, right? Team, I'll not take much time, because time is one thing we already heard from the medical team who has been waiting for you, right? And they also have another scheduled meeting with much more important agenda. So team, without wasting any time, let's get on. Let us see the medical. Let us create that base. You have heard the story about the woodcutter. You need to spend more time in sharpening your axe, right? Before going for cutting the tree. So before you go and launch the Travesite PF to the doctors, let us strengthen our medical with Dr. Darshan and our Dr. Dinesh Patil with us, right? So team, over to the medical team, and all the best for the medical session.
Handing over the session to you, sir.
Siddharth,
Yes,
Arvind,
sir.
please confirm if my slides are visible.
Your slides are visible, sir.
Okay. Thank you for confirming, Arvind. Thank you so much, Siddharth and Arvind, for a kind introduction and also setting up the context for today's launch as well as presentation. So, very good morning, team. Myself, Dr. Darshan Rana from medical team. With me, I have Dr. Dinesh Patil from medical team. So I will be taking you through the medical presentation for revolutionizing glaucoma treatment, a preservative-free travoprost. It's a revolution in glaucoma treatment. As you all know, many patients face the challenges of ocular side effects due to the long-term therapy associated with anti-glaucoma drugs. So for that, we have a solution known as Trevisite PF, preservative-free travoprost. Okay, so first let us understand a little bit zest of glaucoma, epidemiology and burden of disease. As you know, glaucoma is due to sustained rise in intraocular pressure, which causes progressive damage to the optic nerve and eventually may lead to blindness. Although it may have an acute onset, but it is a chronic disease requiring chronic therapy, that is a lifetime treatment with anti-glaucoma drugs. Okay, so because of this, it is associated with ocular side effects. These drugs are associated with ocular side effects, and we also know that it is also important to know that it is the second leading cause of irreversible, but it is a preventable cause of blindness. So if it is treated on time, we can prevent the blindness, and it accounts for 8% of all the cases of blindness globally. And when we consider the Indian scenario, it is the third most common cause of blindness in India, responsible for 12.8% of blindness in the country. And India is responsible for 23.5% of the total causes of blindness. Okay, so we can see the burden of the disease, this glaucoma, contributing to the blindness in India as well as globally. And we all know that medical treatment targeting at intraocular pressure, that targets lowering of the intraocular pressure, might effectively delay or slow down the progression of the glaucoma. So timely treatment is essential for treatment of glaucoma. Now let us understand challenges with the use of conventional eye drops, that is conventional anti-glaucoma eye drops. So as I mentioned earlier, medical treatment is the cornerstone of the glaucoma management. For timely treatment, principally the ocular formulations which are used must be sterile to prevent any infections. So the preservatives are added to maintain the sterility, especially in the case of eye drops which require multi-dose formulations or multiple doses. Okay, and these eye drops, as I mentioned earlier, are associated with potential reasons for side effects known as ocular side effect. It might be ocular inflammation due to allergy or eye sensitivity. It might cause cytotoxic effect, local cytotoxic effect, which may lead to corneal damage, damage to corneal epithelium, damage to conjunctival epithelium or conjunctival injury, impairment of ocular appendages might lead to blepharitis, to name a few. Okay. So this is a good slide where we can see why we need preservatives-free formulation. So when we talk about chronic disease like glaucoma, as I mentioned, it's chronic disease, so it requires frequent administration of eye drops, which might lead to side effects due to preservatives. So as you know, benzalkonium chloride, BAC. So many side effects are associated with this preservative. Then second is in pediatric formulations, in pediatric patients, it might lead to cytotoxic damage in children. So pediatric formulations require preservative-free formulations. And next is patient might be hypersensitivity to this preservative known as BAC. So allergic reactions might be seen. And also from the compliance point of view, it's very important. When we have preservative-free eye drop, it might there are less chances of ocular side effects, and this might improve the adherence to treatment or compliance to treatment. So these are advantages of having a preservative-free eye drops. And now let us understand what is the prevalence of ocular surface disease with the use of conventional eye drops. So ocular surface disease is a common finding in the patients with glaucoma who receive chronic therapy with the topical ocular antihypertensive drugs. And this might significantly impact the quality of the life of the patient. So quality of the life is significantly impacted because of use of conventional anti-glaucoma drugs because of these OSDs. And when we say OSDs, it may be present in 50% of the cases with the symptoms and up to 78% of the cases based on clinical signs. So this is the prevalence which according to studies. And approximately 1 in 6 patients with glaucoma experience OSD symptoms. And this patient with OSD may require separate treatment. So when we see correlation of OSD in glaucoma patient, so as I mentioned earlier, OSD comprises of ocular symptom disease, which include dry eye, meibomian gland dysfunction, which might eventually lead to dry eye, and also blepharitis. Okay, and as I mentioned earlier, OSD patients, the glaucoma patient treated with conventional therapy has high incidence of OSD. Okay, so there is a clear relationship between severity of the disease as well as the duration of the disease as well as the number of anti-glaucoma drugs and frequency of administration. Okay, and when we say dry eye is highly prevalent associated with glaucoma, seen in 8.7 and 1.5% of the patients receiving 2 or 3 anti-glaucoma drugs. Okay. So these are few clinical evidences for OSD in glaucoma. Apologies for this busy slide, but this is very important and I wanted to compare these studies in one slide only. Okay, so here you can see due to tear osmolality. So this is a good study which is published in British Journal of Ophthalmology, and it's mentioned that tear osmolality is elevated in glaucoma and ocular hypertensive patients compared to controlled. So study was done in which glaucoma patients and another group was control, and effect of intraocular pressure lowering drops was compared in this. So it was shown that tear osmolality showed significant correlation with ocular surface disease index as well as TBU2, which is a good factor for ocular surface disease. So it was found that the patient with receiving ocular hypertensive drugs had a high incidence of OSD as mentioned by TBUT as well as ocular surface disease index. And also this second study, which is a Japanese study, and conducted in Japanese population, and how anti-glaucoma eye drops is associated with meibomian gland dysfunction, and it eventually might lead to dry eye. So this study shows that long-term use of anti-glaucoma drugs is associated with changes in meibomian gland dysfunction and function, morphology and function, which might lead to tear film instability and ocular surface disorders. And as I mentioned earlier, benzalkonium chloride is commonly used as a preservative in glaucoma medication, and it is associated with corneal epithelial damage, that is cytotoxicity of cornea. Then it is also associated with inflammation and tear film instability. And due to meibomian gland dysfunction, there is reduced tear production. So this all are part of ocular surface disease, and also subclinical inflammation further disturbs the homeostasis of the tear film, and it might lead to dry eye. So now let us understand what are the characteristics of ocular tissue reactions due to use of preservatives. So one is allergy. Allergy is mainly immune mediated. So sometimes there is allergy to a preservative such as BAC, and our body's immune system might react to this preservative, and it might lead to signs and symptoms such as itching and redness or chemosis. Okay, then toxicity. So ocular toxicity, as I mentioned earlier, it is caused by direct cell damage such to cornea, conjunctiva, or other ocular tissues. So it might lead to symptoms such as burning. So patient might present with intense burning or stinging sensation. These are usually acute reactions. Okay, and also redness in inferior third of corneal epithelial damage. Why inferior third of the eye? because of the concentration of the drug associated with the gravity. So usually the symptoms are seen in inferior third or of the eye or corneal epithelium damage. Next is intolerance, or it is usually due to irritation. Patient may present with discomfort. And second is sensitivity. Some patients are I have low response threshold, so they might require high doses of this drug, and they may present with discomfort. So let us understand the algorithm to treat this patient, okay? And means to treat patient who might require preservative-free eye drops. So this is a very beautiful flow chart here. You can see if the patient is symptomatic, glaucoma patient present with symptoms, okay? Use of preservative-free treatment is highly recommended. Here you can see, okay? If the patient is not symptomatic, okay, then it is recommended to do fluorescein staining, okay. And if in fluorescein staining, if filamentous keratitis is present, okay, then also the use of PF treatment, preservative-free treatment is highly recommended, okay. And if there is no filamentous keratitis, okay, and there are marked corneal staining, then also PF treatment is highly recommended. And if there is no challenges to cornea, or means there is no filamentous keratitis present, there is no corneal staining, but if TFBT, tear film breakout time is less than 5 seconds, then also it is recommended to use PF treatment. Apart from this, any side effects, warning and symptoms, it is recommended. So now let us understand what are the clinical assessment needed for the PF therapy. So one is visual function, okay? So any presence of ocular surface disease, which I mentioned earlier, dry eye disease, corneal epithelial damage, or meibomian gland dysfunction, may potentially result in abnormal tear film, and that can contribute to variable degree of visual dysfunction, which includes contrast sensitivity, visual acuity degrees, and increased optimal aberrations. So this is an indication for the need of PF preservative-free therapy. Then the macroscopic evaluation. So the ophthalmologist will do the macroscopic evaluation of eye under appropriate conditions, and if any signs of ocular surface disease and blepharitis, that is infections of eyelid, or any periocular skin damage or comparative findings in both eye. So this is an indication of PF therapy. And also ophthalmologist will do a slit lamp examination of the eye, and any ocular surface dysfunction found there might be the need of PF therapy, okay. And as I mentioned in the previous flowchart, vital stains like fluorescein dye may be done to see if there is any damage to corneal epithelium or keratitis, and also to see the tear film stability, and there might be an indication for this. So this is after the patient assessment, let us understand what are the indications that might treat the chronic preservative-free ocular topical therapy. Okay, so this is the classification. Okay, here we can see the ocular condition: patient with OSDs, then patient with dry eye, surgical procedures, periocular skin disorders, which I mentioned earlier. Ocular, when we consider ocular topical therapy, previous use of preserved treatments, that is ocular anti-glaucoma drugs containing bark or other preservatives. Then presence of OSDs, intraocular inflammatory disease, documented intolerance or allergy, recurrent discomfort, intermittent visual disturbances are all indications for the use of PF anti-glaucoma drugs. And also like systemic disease such as Sjogren's syndrome, autoimmune disease, SLEs, Wegener's granulomatous, all are indications for the use of preservative-free anti-glaucoma drugs. So this is a classification where it is divided into two groups, group 1 and group 2. Group 1 patient, it is definitely indicated to use PF preservative-free drops. So one is a known allergy to preservative. Second is Sjogren's syndrome, severe dry eye disease, that is stage 3 and stage 4 dry eye disease, atopic dermatitis in children, as well as those in children, there is always an issue of compliance. So it is definitely indicated in children as well as in rosacea. In group 2, clinically relevant dry eye disease, there is stage 2 dry eye disease. Those patients who need concomitant topical therapy and also depending on age, that is lifelong expectancy. Then, as I mentioned earlier, associated with disease of the eyelid, that is blepharitis, and meibomian gland dysfunction, those who have already have dry eyes, then intolerance to preservatives, and at high risk of the need for surgical interventions. Okay, so I will take you through one study. So this is a study done in 158 patient. It is an open label multicentric study. Okay, this study focuses on switching from a preserved, that is preservative containing anti-glaucoma drug, that is prostaglandin analog, to preservative free PG analog. Okay, and eligible patient had at least 2 ocular symptoms and one sign and one symptom during the treatment with latanoprost. So these patients were earlier receiving latanoprost and had 2 ocular symptoms disease or one sign and one symptoms such as Schirmer test and other. So at baseline, these patients who were on latanoprost, they were shifted to preservative-free prostaglandin analog, that is tafluprost, for a period of 12 weeks, and then they were analyzed. Okay, and as I mentioned earlier, they were analyzed for both ocular symptoms as well as ocular signs. So ocular signs which were analyzed are TBUT, tear breakup time, Schirmer's test, fluorescein staining, and evaluation for conjunctival hyperemia, as well as blepharitis on microscopic examination. So the results of this were at the baseline, those patients who were receiving latanoprost, and after 12 weeks, after giving 12 weeks of preservative-free tafluprost. Okay, so when we see IOP, intraocular pressure difference was not much, where we can see it was not that significant. It was 16.8 plus minus 2.5 to 16.4 plus minus 2.4. But when we see the ocular surface disease, okay, it was significantly reduced, such as irritation, burning or stinging sensation, which was present in 56% of the patient, was reduced to 28.4%. Itching, which was present in 46.8%, was reduced by 20% to 26.5% of the patient. Foreign body sensation was reduced from 49.4% to 27.1%. Then tearing was reduced from 55.1 to 27.1. Also, dry eye sensation was reduced from 64.6 to almost 40%, that is 39.4%. When we see signs, abnormal fluorescein staining of cornea, which is an indication for use of preservative-free eye drops, it was reduced from 81.6% to 40.6%. Okay, abnormal fluorescein staining of conjunctiva was reduced from 84.2 to 43.2%. And eyelid inflammation, blepharitis, was reduced from 60.1 to 40.6%. Similarly, conjunctival hyperemia was reduced from 84.2 to 60%. Abnormal Schirmer test was reduced from 71.5 to 59.4%. And tear breakup time, important indicator for dry eye, is reduced from 4.5 to plus 2.5 seconds, increased from 7 to 7.8 seconds. Okay, so these results were quite significant, and it shows the importance of or the effect of using preservative-free eye drops for the treatment of glaucoma. So shifting shifting from preservative-free prostaglandin analogs to preservative-free travoprost might have following advantage. One is decrease in ocular surface disease or ocular toxicity, which might be induced due to use of preservatives like benzalkonium chloride, and also reduce the dry eye symptoms. Okay, because this preservative-free travoprost can help maintaining tear film integrity. Okay. Then is it also improves tolerability and comfort. So as I mentioned earlier, use of preservative-free anti-glaucoma drops is associated with less chances of ocular surface disease. So less chances of ocular surface disease is associated with good treatment adherence. Okay, so it improves the tolerability and comfort to the patient. And also it is safe for long-term use. It reduces the chances of the ocular surface damage. Now let us understand our Travoprost PF, Travocyte PF comes with the Novelia packaging. And what are the advantages of Novelia packaging in glaucoma patient? So preservative-free multi-dose system. So it eliminates the need for preservatives and it eliminates the need for preservatives and also the related side effects, and it improves the dosing precision. Okay, so some patients might have a challenges such as older patients or use of eye drops. So sometimes there are chances that multiple drops, if they want to put only 1 or 2 drops, they might end up putting 3 or 4 drops. Okay, and this might be associated with side effects. Okay, so this Novelia systems helps in precision, as in improving precision. So patented PureFlow technology ensures accurate and consistent drop size delivery, preventing any underdosing or overdosing. And this also eventually helps in improving the patient's compliance by reducing the side effects. Okay, and this one-way valve mechanisms and vented cap design prevents any bacterial contamination over long-term use, thus minimizing microbial contamination, and also decreases the any ocular infection that might occur due to the use of ocular drops for the long term. And also ergonomic bottle and patented blue tip improves the ease of use, especially in elderly and dexterity challenged patients. So it has a user-friendly design. This Novelia packaging helps it's user-friendly to elderly as well as dexterity challenged patients. And also incidence of dry eye with Novelia packaging is very low. And when we see benefits of Novelia packaging in therapy adherence, as I mentioned earlier, it helps in maintaining consistent drop delivery, thereby reducing wastage, reduce overdosing as well as underdosing, and maintains accurate dosing, and prolonged medication use might be associated with less ocular surface disease. And it is preferred by 76% of the patient due to its ergonomic design and simple handling. Okay. And transparency in bottle designs allows the patients to monitor the medication level as well as refilling time and reducing the missed doses. Okay. Then there is a screw on the cap, prevents any leakage, making it convenient for daily use and travel, as well as there is also reduced chances of any contamination due to microbes. So it is considered very secure and portable, so it's very easy to take in luggage while you are traveling. Okay. And it is validated across multiple ophthalmic formulations. So to conclude, that Travocyte PF eye drops, that is preservative-free travoprost, can lead to improved patient benefit, decrease incidence of ocular surface disease, thereby improve patient's quality of life, better compliance, better treatment adherence. So the patient is eventually benefited in long-term therapy, because it's as I mentioned earlier, glaucoma requires chronic long-term therapy, and patient might persist with therapy with the advantage of this preservative-free travoprost with Novelia packaging, thereby improved outcome in glaucoma as well as those undergoing surgery. So these are the references for this presentation. Thank you, everyone. Thank you for your patient listening. Over to you, Arvind and Siddharth. Thank you.
Much for the detailed presentation, and I am pretty confident that the entire team has understood the medical aspects, because we have definitely a long way to go, and definitely we are going to make Travasite PF a mega launch and a successful brand. I'm sure they must be having some queries. So what I would request, team, you can put on chat box, and we would definitely try our level best to make sure whatever queries has been shared as of now, or whatever queries which you must have gathered in your mind, you can just put, so that we can definitely, before we even enter to the field, हम लोग एकदम prepare होके जाएंगे as a warrior to fight the battle. So on behalf of Team iCare, sir, I really want to thank you for your valuable time, sir. Dr. Dinesh sir, Dr. Darshan sir, we thank you for your time. And yes, so now it's time to basically go through the journey. But before we actually enter the journey of launch, there is one thing which I would like to share with you all. Travasite PF, as I've shared in the beginning of the presentation, is going to change of the life of glaucoma patients, right? And for that, it is very much important that we actually understand what are the important aspects that this Travasite PF, or why it is so unique. क्या खास है इस ब्रांड में? Okay, what is the unique point that Travasite PF is having, so that we can understand, we can launch this brand with full-fledged. So before even we start, we would like to cover few things what Dr. Darshan sir has already shared. Team, we all know Darshan sir ने एक point share किया that almost 11.9 million patients actually suffer from glaucoma, right? In terms of the Indian population. उसमें से भी 9 million patients actually go blind. So that is the biggest challenge. और हम सबको पता है, we have been talking about Travasite में कि like 90% of the glaucoma cases go undiagnosed. But there was one point which Dr. Darshan was talking about, that when we talk about in terms of adherence to therapy, so 40% of the patient do not continue to do the therapy. Matlab, if they are prescribed one brand, they do not continue because of ocular side effects. Ocular side effects actually बहुत बड़ा term है, but to cut it short, आप सबको पता है film breakup time, right? You all know about tear osmolarity. So these are the challenges which a glaucoma patient actually suffer from. और आप समझो, it is not like dry eye कि उनको एक हफ्ता 10 दिन का drug लेना है. It is like a lifelong treatment which these patients have to take, right? And that is why it is very much important that we understand the pain of those patients, and accordingly we launch Travasite PF, understanding the medical aspects, why it is so, what is so special about that Travasite PF. सर ने वो 6 पॉइंटर बताया, आई एम प्रीटी श्योर आप लोग ने वो लिख के लिया होगा, बट जस्ट टू एम्फसाइज, टीम, दैट इज कमिंग विद अ यूनिक पैकेजिंग दैट इज कॉल्ड एज Novelia pack, जो which you have already seen in the presentation, multi-dose dropper technology, right, which means that precise dosing for every patient. Just to share with you all, एक latest एक Indian study हुआ था where it was seen that 9 out of 10 patients do not actually instill their drops properly, which means जो requirement है conjunctival sac में, वो requirement या तो वो ज़्यादा ले रहे हैं या तो कम. Okay, so you can understand that is the biggest challenge. And आपके patients कौन है? आपके patients glaucoma patient है, right Sakshat? So these are geriatric patients. वो बेचारे सारे बूढ़े patient है जिनको किसी और पे depend रहना पड़ता है, right? They have to depend on someone जो उनको एक्चुअली ये ड्रॉप्स डालने में हेल्प करेगा. बट देयर आर मेनी पेशेंट्स हु डू नॉट हैव लाइक दैट एडवांटेज, एंड दैट इज द रीजन दिस इज द चैलेंज इन टर्म्स ऑफ ग्लूकोमा थेरेपी. सो सबसे पहले प्योर फ्लो टेक्नोलॉजी जो हम लोग बात कर रहे हैं, इसका सबसे बड़ा एडवांटेज क्या है? तो सबसे बड़ा एडवांटेज है कि वो सारे बूढ़े पेशेंट्स के लिए, जीराटिक पेशेंट्स के लिए देयर इज अ ब्लू टिप. जब आपको एक्चुअल आई ड्रॉप देखने को मिलेगा ट्रेवसाइट पीएफ का, आप देखोगे देयर इज अ ब्लू टिप at the top of that Travasite PF. That blue tip is going to actually help these patients to actually take the drops properly. Okay, that is first. We have shared it's a preservative free, which means it does not require preservatives, and that is how it is able to extend its shelf life. We are talking about big brands which are there in the market of Bimeto, Latano. They all contain preservatives, and that is the challenge today. Okay. Second, accurate dosing, calibrated and accurate dosing. Third, wastage of drops. You can understand, एक 1 day का therapy, if you talk about in the entire Travoprost, Travasite का सबसे low cost है एक दिन का therapy का. बट अगर आप बात करते हो मल्टीनेशनल जो ब्रांड्स हैं जो 932 रुपीज में प्राइस्ड है, 800 रुपीज में प्राइस्ड है, दोज ब्रांड्स, जस्ट इमेजिन द कॉस्ट ऑफ थेरेपी ऑफ 1 day, एंड डॉक्टर इज रिकमेंडिंग देम 1 ड्रॉप, राइट? और उसमें से अगर उस पेशेंट ने 3 ड्रॉप वेस्ट ही कर दिया बिकॉज उनको पता नहीं है कि प्रॉपर जा रहा है कि नहीं जा रहा है, तो दैट इज गोइंग टू मेक अ बिग कंसर्न फॉर दोज पेशेंट्स. सो these challenges will now be taken care of with Travasite PF. Apart from that, OHDI, we are talking about T-Butt, we are talking about tear film osmolarity. All these challenges are going to be taken care with Travasite PF, because Travasite PF will not only take care of IOP, but also it will take care of the ocular surface. So this was just a gist, because bolte na picture to abhi baki hai. So that is why we are all here, and that is how it gives me a pleasure to Sakshat. You already know Sakshat. He has been there in the role of taking care of the glaucoma brands. So now it's time to actually take you through the journey of Travasite PF launch. So once again, we officially invite you, or we once again officially would like to take this advantage to take you through the mega launch meet. Okay, so over to you, Sakshat.
So good morning team. How is the Josh? So I know that definitely the Josh will be high. Welcome you to this again launch meet of Travasite PF. So most of the part, like the medical part, thanks to the Darshan sir, Dr. Darshan, and Arvind sir has also thrown some light on this, what is about the Novella packaging, right? So thank you for Arvind sir too. Now from here onwards, we will be covering the marketing aspects, like what will be the strategical plans, how we will execute the tactical plans for the year for Travasite PF. So welcome to the again mega launch meet, starting with the presentations. The first is the agenda. In this PPT, we will be covering the prevalence of glaucoma and OSDI, the opportunities which are there in the market, the launch journey, promotional strategies, objectives, and what are the rewards and recognitions for you people, right? Moving ahead, glaucoma, the prevalence and the burden. So if we see, glaucoma is the 3rd largest cause of blindness in the world, around the world. In the burden of glaucoma is almost approx 12 million. And prevalence of blindness is 8.9 million, out of which 90% of glaucoma cases still remain undiagnosed, which is a big cause of concern. Now the challenges. What are the challenges in the patients due to the glaucoma? Adherence is a very big challenge in glaucoma as a therapy. So we have pointed out 3 major reasons, right? So first is the ocular adverse event increases the percentage of the patients with hyperemia, burning, stinging, and the foreign body sensation. Second, the OSDI, which is the ocular surface disease index score. So 59% of patients have increased symptoms of ocular and toxicity, which increases the tear breakup time. Third is the poor drug installation. We have that Arvind sir has also highlighted that 9 out of 10 patients are unable to instill their drop correctly, and which 25% of the patient instill the drop more than required in the conjunctival sub. Because of these 3 major reasons, 40% of glaucoma patients have dropped out from the existing glaucoma therapy, leading to non-adherence. So the side effects profile. So if we see side effects profile, basically the ocular surface disease, conjunctival inflammations, allergic reactions, and dry eyes. So if we see ocular surface disease is 83%, which is the main side effects in the glaucoma patients. The side effects with the glaucoma therapy, despite we all know there are a lot of PG analogs which are in the first line treatment of IOP, lowering agents are there, but there is a significant percentage of patients suffer from ocular surface complications such as hyperemia, which is the redness of eyes, SPK, which is the superficial punctate keratitis, and altered OSDI. So team, there is a need remains for the ocular friendly analog with an improved adherence. So are you ready, team, to make this again a history? So definitely I know that you will be very eagerly to wait. So ready for the mega launch. Yeah. So definitely you must be excited, team, for the mega launch. So starting with
Great. Wow, the excitement is visible and the team is actually very much excited. It is definitely going to change the life of glaucoma patients, and it is excitement for us also because we can feel the vibrates, right?
yes, sir.
So अब वो घड़ी आ गई है, right? So very soon we'll unveil the brand Travesite PF, but देखते हैं लोगों का excitement कैसा है. Are you all ready?
So are you ready, people, to create a history in the ocular surface disease? We are going to launch a big brand, right, which is the Travesite PF. We want that energy in the team with you, right? Bring that energy, bring that enthusiasm that we are launching a new brand.
Wow, the enthusiasm is visible and जैसे बोलते हैं हार्ट बीट बढ़ता है वैसे ही मुझे लग रहा है अब काउंटडाउन स्टार्ट होने वाला है. सो आई थिंक 10, 9, 8, 7, 6, 5, 4, 3, 2, 1 and here we go. Come on, Tim.
Come on, Ritesh. Come on, everyone. Come on, I can.
Can we have the entire ICAT team on board? Come on! Wow, what a entry, superb. मजा आ गया ना? So, अगर आगाज ऐसा है तो definitely we'll make this brand to the top and this gives us a pleasure to not only understand, हमने सबने देख लिया right as of now कि ग्लोकोमा पेशेंट्स की तकलीफ क्या है, हम लोग कैसे उसको सॉल्व करने वाले हैं, बट हम लोग क्या एक ब्लाइंड हॉर्स के जैसे रन कर सकते हैं? नहीं, राइट? तो वी वुड ऑल्सो लाइक टू अंडरस्टैंड कि हम लोग किसको एक्चुअली टारगेट करेंगे, कैसे करेंगे काम. ये हमने सब बड़ा बड़ा देख लिया, फिगर्स, इतने सारे ग्लोकोमा पेशेंट हैं, इतना सारा चैलेंज है, नोविलिया पीएफ का लॉन्च हमने देख लिया जो एकदम धड़ाकेदार हुआ. बट नाउ इट्स टाइम टू अंडरस्टैंड what is the huge opportunity that we have to offer for this anti-glaucoma portfolio. So team, when we talk about the opportunity, definitely we have many things to share with you, and yes, Sakshat, can we share with the team?
Yeah, definitely. So moving forward, we'll seeing the opportunities which are there in the market for you. So again, the huge opportunity which we have, like 11.9 million people of like patients are there in India for glaucoma, out of which 6 million suffers from OSDI due to the glaucoma drug, and 4 million dropouts are there like due to the therapy adherence. So see the gap which is there in the market and see what our brand is offering for them.
बाप रे. So you're talking about, Sakshat, 4 million dropout हो जाता है, मतलब टीम ट्राई टू अंडरस्टैंड, जब हम लोग ड्रॉप आउट की बात कर रहे हैं उसका मतलब क्या है? इसका मतलब एक सिंपल सा है, डॉक्टर ने मुझे एक दवा प्रिस्क्राइब किया, द डॉक्टर हैज प्रिस्क्राइब्ड मी वन मेडिसिन, ओके, बट बिकॉज ऑफ द साइड इफेक्ट्स आई एम नॉट एबल टू कंटिन्यू टू माई थेरेपी, एंड दैट साइड इफेक्ट्स डॉक्टर राणा हैज ऑलरेडी एक्सप्लेन्ड, वी हैव ऑलरेडी सीन इस स्लाइड में इसके पहले, राइट? सो द चैलेंजेस आर ह्यूज, बट हम लोग यहाँ पे सोल्यूशन ऑफर करने आए, राइट? एंड दैट इज व्हाई इट इज इंपॉर्टेंट फॉर अस टू अंडरस्टैंड कि कितने बड़े पॉपुलेशन को हम लोग हिट करेंगे. सो प्लीज लेट अस बी ऑल अटेंटिव, इंटरैक्टिव, so that we understand each and every point. Yes, Sakshat.
Yes, sir. Thank you. So if the huge opportunities of 6 million patients of glaucoma are already there, see there are 1 lakh prescriptions of PG analog per month. So this is the opportunity which we are having. So approximately like 2700 units of PG analog are sold in each of your headquarters, right? The BMO is sitting in Delhi, the BMO is sitting in Jaipur, Coimbatore, Ghaziabad, Lucknow, right? So there is the opportunity, the mega opportunity which you are having in each one of your headquarters, 2700 units of PG analog. So coming, that is also equal to like each BM needs to convert 50 doctors per MR. Okay, that big is the market which we are going, which we have launched the brand, right? Coming to the next top selling brands, definitely there are the top selling brands of like Travaten is there of JB Chemicals, there is Latoprost of Sun Pharma, right? Lumigan is there of FB, but the main cause of concern is that they contain preservatives like Polycord is there, sodium sorbate and BAC. They are loaded with preservative.
Right, right. And Sakshat, this is a challenge. Can we go back to the slide, Sakshat? टीम, आप लोग जब विजिट करते हो डॉक्टर्स को, व्हेन यू विजिट टू योर डॉक्टर्स, आज तक क्या किसी ने देखा है कि ये जो ब्रांड्स डॉक्टर लिख रहे हैं, आज तक कभी हमने ये पैक को पलटी करके देखा नहीं होगा, राइट? बट व्हाट आई वुड रिक्वेस्ट यू, आपके बाद जब आप जाओगे, जब आप डेफिनेटली ट्रेवसाइट पीएफ को लॉन्च करोगे, एक बार जरूर ये डॉक्टर को भी दिखाओ और आप भी देखो कि सर बहुत अच्छी बात है आप लोग पेशेंट को आईओपी लोअरिंग के लिए दे रहे हो, बट सर एट द सेम टाइम पेशेंट का क्वालिटी ऑफ लाइफ भी कॉम्प्रोमाइज हो रहा है. क्यों? क्योंकि कभी किसी ने वो कार्टन का जो साइड वाला था जिसमें पोटेशियम सॉर्बेट था, या तो फिर आयोनिक बफर था, या तो फिर मान लीजिए बीएके है, लुमिगन जैसे ब्रांड में, विच इज अ इंपोर्टेड ब्रांड, राइट? उसमें भी आज के रेट में बीएके है. तो आप सोचो ये सारे ब्रांड कोई छोटे मोटे ब्रांड नहीं, राइट? दीज आर 30 करोड़, 40 करोड़, 50 करोड़ ब्रांड्स, and those brands are with BAK. So it's a huge opportunity to offer a solution which is not only going to help those patients, but आप सोचिए वो पेशेंट का जो ऑलरेडी एक थेरेपी पे चल रहा है, इतने साल से बेचारा ले रहा है, ये लैटोप्रोस्ट आरटी बोलूं मैं, ट्रेवाटैन बोलूं मैं, या तो फिर लुमिगैन बोलूं मैं, इतने दिन से ले रहा है. क्यों? क्योंकि उसके पास कोई चॉइस नहीं है. बट अब वो प्रॉब्लम उनका सॉल्व होने वाला है, राइट? बिकॉज वी हैव ट्रेवसाइट पीएफ विथ अस. ह्यूज अपॉर्चुनिटी. साक्षात बता रहा था कि आप सोचिए आज के डेट में टीम 13,000 डॉक्टर्स हैं जो पीजी एनालॉग लिखते हैं. मतलब एकदम सिंपल में अगर आपको मैं बताऊं तो हर एक आपके हेडक्वार्टर में 75 डॉक्टर हैं जो बायोमेटोप्रोस्ट, लेटेनोप्रोस्ट, ट्रेवोप्रोस्ट मिला के 75 डॉक्टर है. आपके डॉक्टर लिस्ट में कितने डॉक्टर्स होंगे? 100, 150, राइट? उसमें से अगर मैं ट्रेवसाइट की टैग डॉक्टर्स की बात करूं तो 30, 40 मैक्सिमम, किसी के टेरिटरी में मान लीजिए 50 होगा या 20 भी होगा. बट पोटेंशियल कितना है, अपॉर्चुनिटी कितना है? तो देयर आर 75 डॉक्टर्स इन ईच एंड एवरी टेरिटरी ऑफ यू वेयर हु आर एक्चुअली राइटिंग आइदर बायोमेटो और लेटेनो और ट्रेवोप्रोस्ट, which includes Travasite also. So the opportunity is huge. लेकिन जब हम लोग ट्रेवोप्रोस्ट की बात करते हैं तो बस 20 डॉक्टर पूरा मॉलिक्यूल लिखता है. मैं ट्रेवसाइट की बात भी नहीं कर रहा हूं. अक्रॉस इंडिया अगर मैं देखूं तो 6,000 डॉक्टर्स होंगे. 12,000 में से मतलब टोटल बड़ा पॉपुलेशन जो है हमारे इंटरनल या एक्सटर्नल की बात करूं तो दैट माइट बी अराउंड 2,500, 3,000 डॉक्टर्स हु आर राइटिंग ट्रेवसाइट एज अ ब्रांड. सो वी आर 1/6 ऑफ द टोटल पोटेंशियल. सो टीम, ये एक ऐसा मौका है जो हम लोग पूरे मार्केट को चेंज कर सकते हैं. बट ये कैसे होगा? ये तभी हो पाएगा जब हम समझे कि हम लोग वो छोटी वाली फिश नहीं है, हम लोग वो शार्क है, वो वेल है जो पूरे सागर को रोल करने वाले हैं, राइट? सो आई वांट यू गाइस टू डोमिनेट दैट मार्केट विद दिस बेनिफिट्स दैट वी आर गोइंग टू ऑफर. कैन वी कंटिन्यू, Sakshat?
Yeah, thank you, sir. So moving forward, we'll see the benefits of preservative-free travoprost. So the treatment with preservative-free travoprost is definitely beneficial effect on the ocular surface, such as reduces the prevalence of SPK, which is superficial punctate keratitis, and decreases the rate of hyperemia, while also shows similar IOP lowering efficacy comparable to back preserved latanoprost. Coming to the preservative-free travoprost, so there is significantly ocular surface symptoms reduction as compared to back preserved travoprost, and favorable options in the primary open angle glaucoma patients with ocular surface disease symptoms.
राइट एग्जैक्टली साक्षात ये स्लाइड मैं चाहता हूं मेरी टीम देखे। उसका रीजन ये है कि टीम हम जब भी बात करते हैं कोई भी स्टडी की, तो सब लोग बोलते हैं सर ये तो यूएस का स्टडी है, आप हमको क्यों दिखा रहे हो ये सारी चीजें। टीम ये एक इंडियन स्टडी है, राइट। आप में से ही कुछ आपके जो डॉक्टर्स हैं उन्होंने ये स्टडी पे काम किया है, ओके। और ये स्टडी में जब हम लोग बात करते हैं ना 9 आउट ऑफ 10 पेशेंट्स, 25% ऑफ द पेशेंट जो बेचारे मेडिसिन नहीं ले पाते हैं ठीक से, कंजंक्टिवल सैक का रिक्वायरमेंट कितना है और वो कितना ड्रॉप वेस्ट हो जाता है उनका उस रिक्वायरमेंट के हिसाब से, तो यू कैन अंडरस्टैंड ये एक इंडियन स्टडी है जिसमें क्लियर कट कन्वे किया गया कि इफ यू हैव वन ड्रग विच इज प्रिजर्व्ड travoprost, which can be any brand, it can be Travatan, it can be Tovaxo, it can be Travo, it can be Lupitraos, any brand, and you have one brand which is Travasite PF, it is going to add value to those patients. ठीक है, आप देख रहे थे साक्षात बता रहा था SPK, अब इतने भारी भरकम टेंशन में मत आइए कि सर ये क्या बता रहे हो आप SPK, it is simple, superficial like punctate keratopathy, which means आपके जो कॉर्निया के सेल्स हैं वो बेचारे डैमेज हो रहे, तो आप एक साइड में उनको ग्लोकोमा का ड्रग दे रहे हो, दूसरी तरफ में उनको कॉर्निया के सेल्स को डैमेज कर रहे हो। सो दिस इज अ चैलेंज, सबको पता था, किसी के पास इसका आंसर नहीं था, राइट। टुडे वी हैव दैट आंसर विथ यू विथ ट्रावसाइट पीएफ। यस अक्षत।
So definitely we'll see this. So team, it's time to make the right move in the glaucoma management. So here again we are just revealing our pack, which is our Travasite PF. So this is the actual pack, which how it looks in a Novelia packaging bottle, okay.
And this is transparent bottle. Let me tell you, हम लोग जो ब्लू टिप की बात कर रहे थे, सबको ब्लू टिप दिखाई दे रहा है ऊपर, राइट। सो दैट ब्लू टिप इज नथिंग बट, पेशेंट को कैसे समझेगा कि ड्रॉप प्रॉपर मेरे आंख में जाने वाला है। दैट ब्लू टिप इज बेसिकली द अर्गोनॉमिक डिजाइन, पेशेंट फ्रेंडली डिजाइन। ये बस इंडिया में नहीं है टीम, ये यूएस मार्केट में भी ये जो ब्लू टिप का पेटेंटेड आई ड्रॉप टेक्नोलॉजी है, दैट इज कॉल्ड एज नोविलिया प्योर फ्लो मल्टी डोज ड्रॉपर, आप इसको कोई भी नाम दो, बट इसका काम एक ही है, कैसे प्रिजर्वेटिव फ्री, बिना कंटैमिनेशन के, बिना ओएसडीआई के चैलेंज के, हर एक पेशेंट को परफेक्ट ड्रॉप उसके आंख में डिलीवर करूं, ये इस ब्लू टिप का काम है, राइट। सो दिस इज नथिंग बट ब्लू टिप, व्हाट यू आर एबल टू सी। जब भी पेशेंट को ड्रॉप लेना होगा, सिंपल इस ब्लू टिप को देखेगा और वो थोड़ा सा प्रेस करेगा। उसका फायदा क्या होगा पेशेंट को, तो ब्लू टिप जब वो देख के प्रेस कर रहा है, एक टाइम पे एक ड्रॉप ही उसके आंख में जाएगा, फर्स्ट चीज। सेकेंड, एक से ज्यादा ड्रॉप नहीं जाएगा, तो वेस्टेज नहीं होगा। बिकॉज आप सोचिए, अगर उसको 600 रुपए, 800 रुपए, 900 रुपए का एक बॉटल मिल रहा है, उस बॉटल में मुश्किल से बेचारे का 1 महीने का थेरेपी है, राइट, और उसमें से 5 ड्रॉप तो एक दिन में वो वेस्ट हो गया, तो कितना थेरेपी वो कंटिन्यू कर पाएगा। और ये सारे ग्लोकोमा पेशेंट्स रिटायर्ड पेशेंट है, जीरियाटिक पेशेंट है, जिसको किसी और पे डिपेंडेंट रहना पड़ता है अपने दवा के कॉस्ट को बेयर करने के लिए, तो यू आर गोइंग टू चेंज लाइफ ऑफ दोज पेशेंट्स विथ ट्रावसाइट पीएफ। यस अक्षत।
So this is the actual image of the pack, how it looks to him. So this is your Travasite PFs, and this is our tagline, which is an ocular friendly travoprost with improved adherence. So definitely we need to improve our adherence of the glaucoma patients. You have seen that 40% patients are doing dropout from the existing glaucoma therapy. So that's the line, that's our line of a which we are going to punch in the doctor's clinic, and ocular friendly travoprost with improved adherence. So this is the molecule which you are already aware, travoprost 0.004% weight by volume, pack size will be 5 ml, MRP will be 499 and the WBR will be 385.
So किसी ने देखा है क्या? मैं मतलब I would request people can reply in chat box. अभी तक किसी ने देखा है पैक? I think आपके CNF वगैरह में तो आ गया है। ओ लेट अस सी, आई एम कॉन्फिडेंट, डेफिनेटली लोग एकदम एक्साइटेड हैं इसको देखने के लिए, और मैं तो आई एम कॉन्फिडेंट कि जैसे ही ये पैक एक्चुअल में मार्केट में आप लोग के हाथ में आएगा, आप लोग अच्छे से इसको देखिएगा, बिकॉज दिस इज अ टेक्नोलॉजी विच इज वेरी मच इंपॉर्टेंट, राइट? इट इज गोइंग टू ऐड वैल्यू टू योर पेशेंट्स, और आपके रेवेन्यू में भी ऐड करेगा, तो आपको इंसेंटिव अर्निंग में ये सारे बेनिफिट्स डेफिनेटली आगे फ्यूचर में ऐड होने वाले। यस अक्षत।
So moving on to the positioning of Travicide team, which we all know, which is in primary open angle glaucoma and ocular hypertension. Similarly, for the Travicide PF is in patients who are existing on the PG analog therapy and there is a lack of adherence due to the ocular tolerability issues. So that will be the specific positioning for Travicide PF. So doctor selection, as we all know, all the tag doctors of Travicide, so the 6,500 doctors, and the non-prescribers are which out of 3,200 doctors.
So साक्षात मेरा एक छोटा सा क्वेश्चन था यहाँ पे यार, मतलब हमारी टीम जो है ये ट्रेविसाइड पीएफ तो ट्रेविसाइड के टैग डॉक्टर्स को ही करेंगे, राइट?
राइट।
तो फिर मतलब ऐसा नहीं होगा ना, मतलब कि उनको टेंशन आएगा कि सर क्या होगा ट्रेविसाइड का, सर ट्रेविसाइड पीएफ लॉन्च किया तो?
No sir, definitely we have the different tacticals and the strategical plans separately from as compared to Travicide, and we'll see in the further slides like what are the plans.
Exactly साक्षात। और टीम आप सबको पता ही ये बात, हम लोग जब बात कर रहे हैं नॉन प्रिस्क्राइबर्स, आज के डेट में आपके लिस्ट में 40-50 जितने भी टैग डॉक्टर्स हैं ट्रेविसाइड के लिए, क्या सब लोग लिखते हैं हमारा ब्रांड? नहीं, सब लोग नहीं लिखते, क्योंकि अगर सब लोग लिखते हैं तो आज के डेट में हम लोग जो 1 CR की बात कर रहे हैं वो कब का क्रॉस कर चुके होते हैं, राइट? तो आप सबके पता है आपके लिस्ट में हार्डली वो 20-15 अच्छे से प्रिस्क्राइब करने वाले, अगर मैं बोलूं, हम लोग मिनिमम कट ऑफ की बात नहीं कर रहे, वी आर टॉकिंग अबाउट गुड प्रिस्क्राइबर्स, राइट? सो हमारे पास बहुत सारे ऐसे डॉक्टर्स हैं जो ट्रेविसाइड बहुत ही कम लिखते हैं, नॉन प्रिस्क्राइबर्स है पूरी तरीके से। सोचिए जब ट्रेविसाइड पीएफ आपके पास आएगा तो आपके पास हर एक डॉक्टर के लिए 2 ऑप्शंस हमेशा अवेलेबल रहेगा। एक तो जो हमेशा से बोलता था कि यार मेरे को तो इंपोर्टेड ब्रांड चाहिए, तो सर ये लो इंपोर्टेड ब्रांड, राइट? ट्रेविसाइड पीएफ, जो आपके हाई क्लास पेशेंट्स के लिए डेफिनेटली कोई प्रॉब्लम नहीं है, क्योंकि ग्लोकोमा पेशेंट का कुछ ऐसा सबसे बड़ा चैलेंज क्या होता है, सोचिए ना आप, ग्लोकोमा पेशेंट्स के लिए बेचारा आई ड्रॉप डाल रहा है, हाइपरिएमिया हो गया, लाल हो गई आंखें, वो टेंशन में है कि मैं ऑफिस कैसे जाऊंगा, राइट? तो there are many challenges that a glaucoma patient actually comes across, right? So those patients who जिसके लिए ये टॉलरेबिलिटी, ये OHDI, ये सारे challenges बहुत मैटर करता है, वो पेशेंट्स के लिए डेफिनेटली ट्रेविसाइड पीएफ विल चेंज द लाइफ, एंड वी वुड नॉट लाइक टू मिस द अपॉर्चुनिटी कि हम लोग ट्रेविसाइड पीएफ को सर अच्छे से नहीं बताएंगे। क्यों? क्योंकि सर ट्रेविसाइड बंद हो जाएगा। टीम, ऐसा कुछ नहीं होने वाला है, लेट मी टेल यू इन राइटिंग, ट्रेविसाइड और ज्यादा बूम करेगा। क्यों? क्योंकि आप वो पहली कंपनी हो, आप वो पहले डिवीजन में हो जो नोविलिया पैक के साथ ग्लोकोमा ड्रॉप को लाने वाला है। देयर आर ब्रांड्स व्हिच आर देयर इन द मार्केट, बट उसका इंडिया के मैप में विजिबिलिटी कुछ स्टेट्स तक ही लिमिटेड है। तो हमारे पास अपॉर्चुनिटी है, हम लोग नंबर 1 ब्रांड है ट्रेविसाइड, ट्रेवोप्रॉस्ट के मार्केट में इन टर्म्स ऑफ यूनिट्स। वी आर ऑलमोस्ट डूइंग वेरी गुड इंटरनली एक्सटर्नली विद ट्रेविसाइड, और ट्रेवोप्रॉस्ट में आप रोर करते हो। हम लोग ने काफी प्रोग्राम्स किए ग्लोकोमा इंडिया एजुकेशन के, बहुत सारे डॉक्टर्स ने सीधा बोला हम लोग ट्रेविसाइड लिखते हैं या ट्रेवोप्रॉस्ट लिखते हैं ना, ब्रांड नाम जो नहीं ले सकते। तो ये इक्विटी आपने क्रिएट किया है, और हम नहीं चाहते ट्रेविसाइड पीएफ को हम लोग लिमिटेड जगह तक रखें। दैट इज द रीजन, लेट अस गो ऑल द वे टू लॉन्च ट्रेविसाइड पीएफ टू ऑल द टैग डॉक्टर्स एंड टिपिकली दोज नॉन प्रिस्क्राइबर्स जो आज तक बहाना बना रहे थे कि मेरे ब्रांड पेशेंट्स को इंपोर्टेड ब्रांड चाहिए, या वो ट्रेविटैन लिख रहे, लुमिगैन लिख रहे, लेटोप्रॉस्ट आरटी लिख रहे, लेकिन ट्रेविसाइड नहीं लिख रहे थे। तो हमारे पास ये पूरा एजेंडा है कि हम लोग ट्रेविसाइड पीएफ सबसे पहले उनको जाके हिट करें जो हमारा ट्रेविसाइड नहीं लिख रहे थे, टैग्ड में तो इतने दिन से बैठे हैं लेकिन हमारे लिए सपोर्ट नहीं कर रहे थे। ठीक है, वी हैव द एंटायर बकेट, हमने आपको पूरा बास्केट ऑफर करने वाले कि कैसे ट्रेविसाइड पीएफ को बड़ा ब्रांड बनाएंगे। बट हमारा माइंडसेट हम लोग को क्लियर रखना पड़ेगा कि ट्रेविसाइड पीएफ को बड़ा ब्रांड बनाना ही है। ट्रेविसाइड एज अ ग्रुप शुड एक्चुअली, जो हमारा आई केयर का बेस है उसको टिपिकली बहुत स्ट्रेंथन करना है ट्रेविसाइड पीएफ लॉन्च के साथ। यस अक्षत।
So team, moving ahead, this will be the communication theme for the of Travicide PF. So we have to restore the quality of life of our glaucoma patients. So the VA communication, the most important part. So as you are aware team, that the VA communication is one of the important when it comes to in-clinic detailing, right? The doctor in this doctor's clinic, you need to discuss the science, how Novelia is like we are bringing up this unique packaging first time in the market. So this is your VA opener page. So see the statement, 59% of patients suffer from, glaucoma patients suffer from ocular surface disease as a comorbidity, affecting and worsening their quality of life. So again, this is a big cause of concern, right?
बाप रे, तो सोचो अगर 100 पेशेंट को किसी ने ड्रॉप दिया है, उसमें से 59 पेशेंट्स ऑलरेडी बेचारे चैलेंज करके बैठे हैं। क्यों? क्योंकि वो एक साथ में ड्रॉप तो ले रहे, बट उनका क्वालिटी ऑफ लाइफ ऑलरेडी हैम्पर हो चुका है। डॉक्टर ने जो भी दवा दी हो, उसके वजह से OHDI जो है, ऑकुलर सरफेस डिजीज, उनका टीयर फिल्म, उनका ब्रेकअप टाइम, उनका ऑस्मोलैरिटी, सारा ऑलरेडी स्टेक पे है। सो दिस इज अ ह्यूज ग्रुप टीम। हम लोग 11-12 मिलियन की बात कर रहे थे, आप सोचिए 8-6 मिलियन को ऑलरेडी ये प्रॉब्लम है, राइट साक्षात? यस।
So coming to the further page of VA, so help them to restore the quality of life by making the right move in the glaucoma management. So this is your main introducing page, right? You have to introduce, you have to detail to the doctor that doctor bringing up for the first time in India, which is Travicide PF and ocular friendly travoprost for an improved adherence. So these are the three main points we need to highlight to the doctor. First, the preservative-free multi-dose dropper technology. Second, significantly improves the ocular surface disease symptoms. Third, decrease the hyperemia and equal IOP lowering as compared to Bimato and latanoprost. So going into detail in this each point. So the first point, developed with the Novelia packing and the multi-dose dropper pure flow technology. So what is the advantages of this technology? So it delivers the consistent drops for better patient adherence. Calibrated drops are there for precise dosing for better adherence and to the treatment, prevents bacterial contamination. It does not allow the air to go inside the bottle, and hence the need of preservative is not there. It is self-preserve, and it also respects the ocular surface and reduces the ocular toxicity. So coming to the fourth page of the VA, we have highlighted a study of the POAG patients when it is compared with preserved travoprost. So there is an effective option of IOP reductions is there while avoiding the preservative exposure to the POAG patients, and 90% of patient experiences the improvement in symptoms in ocular surface disease symptoms. Equivalent IOP lowering is there as without conjunctival hyperemia.
So साक्षात यहाँ पे मैं चाहूंगा पूरी टीम आप लोग थोड़ा सा ध्यान दीजिए। यहाँ पे हम लोग कौन से ब्रांड को हिट करने वाले हैं, आप लोग मैसेज करके बता सकते हो चैट बॉक्स में। डेफिनेटली वी आर टॉकिंग अबाउट विच ब्रांड्स। जब हम लोग बोल रहे हैं फेवरेबल ट्रीटमेंट ऑप्शन, राइट, ये लाइन हमने अपने मन से कॉइन नहीं किया है, ये स्टडी का लाइन है। सो इट इज, यस यू आर राइट, वी आर टॉकिंग अबाउट ट्रावेटैन मैन। आपका टोवैक्सो, आपका लुपिट्रॉल, जितने भी ब्रांड्स है, राइट, एग्जैक्टली यू आर राइट। सो वी आर टॉकिंग अबाउट ट्रावेटैन। हम लोग ट्रावेटैन के जो डॉक्टर्स हैं उनको सबसे पहले जाके ये पेज पे हिट करना है। क्या हिट करना है कि सर आपके जो पेशेंट्स ऑलरेडी ड्रग ले रहे थे उनको ट्रावेटैन जो ऑलरेडी आप प्रिस्क्राइब कर रहे थे उनके लिए अब समय आ गया है, राइट। नाउ इट्स द टाइम कि जो पेशेंट आपके ट्रावेटैन पे थे या टोवैक्सो पे थे या ट्रैवो पे थे या लुपिट्रॉस पे थे, जो भी ABCD ब्रांड लिख रहे थे, अब आपके पास एक फेवरेबल चॉइस है कि आप उनको ट्रेविसाइड PF पे शिफ्ट कर सकते हो। क्यों शिफ्ट कर सकते हो सर? क्योंकि 90% ऑफ द पेशेंट जो पहले ट्रेवोप्रोस्ट का कोई भी ब्रांड ले रहे थे, अभी उनका जो ऑक्यूलर सरफेस डिजीज जब आप उनको शिफ्ट करोगे तो इंप्रूव हो गया। ये सर एलेम्बिक आई केयर टीम में से जाके हमारा कोई भी साक्षात बोलने के लिए नहीं आ रहा है, ये श्रीधर जी नहीं बोल रहे हैं, ये फॉर एग्जांपल तौसीफ जी नहीं बोल रहे हैं, बट ये डॉक्टर, ये जर्नल का पॉइंट है, राइट। दिस इज अ जर्नल, इंडियन जर्नल, विच स्टेट्स क्लियरली कि डॉक्टर 90% ऑफ द पेशेंट जिनको आप प्रिजर्व्ड ट्रेवोप्रोस्ट मतलब ट्रावेटैन या कोई भी ब्रांड से आप जब ने शिफ्ट किया, 90% इंप्रूवमेंट इन ऑक्यूलर सरफेस डिजीज, राइट। फर्स्ट पॉइंट। सेकेंड, देयर आर कुछ डॉक्टर्स ऐसे होंगे जो ये बोलते होंगे कि हमने भले शिफ्ट कर दिया लेकिन कुछ कुछ परसेंटेज को आपके मॉलिक्यूल में भी हाइपरीमिया का चैलेंज है। तो ये जवाब है सर कि जब आप ट्रेवसाइट पीएफ पे शिफ्ट करोगे तो डेफिनेटली आईयूपी लोअरिंग तो आपका कॉम्प्रोमाइज होगा ही नहीं, बट एट द सेम टाइम हाइपरीमिया भी कंट्रोल होगा। तो टीम, आप एक साथ दो ऑप्शन दे रहे हो डॉक्टर को। सर, एक, आप कोई भी ट्रेवोप्रोस्ट अगर आप ब्रांड लिख रहे हो पहले से, आई एम नॉट टॉकिंग अबाउट आप ट्रेवसाइट से ही ट्रेवसाइट पीएफ पे शिफ्ट करो, आई एम टॉकिंग अबाउट ट्रेवेटन, टोवैक्सो, लुपिट्रॉस, कोई भी ब्रांड डॉक्टर लिख रहा है, क्योंकि ऐसा तो होगा नहीं डॉक्टर कि सारे डॉक्टर बस हमारा ही ब्रांड लिखते होंगे, राइट? तो वो डॉक्टर्स को सबसे पहले जाके आप ट्रेवसाइट पीएफ पे कन्वर्ट करिए, ठीक है? अगर वो ट्रेवसाइट अच्छा लिख रहा है, वेरी गुड सर, थैंक यू सो मच। बट अगर आप कोई और मॉलिक्यूल के भी पेशेंट होंगे, जो साक्षात आपको नेक्स्ट पेज पे बताएगा, अगर आप वो कोई और मॉलिक्यूल के भी पेशेंट को शिफ्ट करोगे तो डेफिनेटली एडवांटेज आपके पेशेंट को मिलेगा। यस साक्षात।
Yeah, thank you, sir. So, team, make sure you highlight this page number 4, which is we have compared a study within preserved travoprost. Definitely, we need to hit the Travatan as a brand, and we need to detail this study. Like, what are the 90% of the patients? The equivalent IOP lowering is there, conjunctival, which less conjunctival hyperemia. You need to discuss the scientific content with this of the VA with the doctor in clinic. So, coming to the next page of the VA, which is page number 5. So this is a favorable treatment option again in the PAG patient, but with whom? With the patients who are on latanoprost. So similarly, IOP like control is there as compared to latanoprost as bimatoprost in Travicide PF, and beneficial effect is there on ocular surface, improving the hyperemia and symptoms like hyperemia and SPKs, and improve OSDI scoring is there, like if we see within 8 weeks of treatment. So this part you need to highlight, and where if a doctor is writing latanoprost brand and you know which is the most largest brand in the latanoprost, can you
Right.
guess the team which is that brand? Please reply in the chat box. Which is the biggest brand of latanoprost?
टीम, जस्ट टू शेयर विथ यू ऑल, साक्षात तो पूछ रहा है आपको लेटोप्रोस्ट आरटी, यस
Right.
यू गाइज आर राइट,
Right.
बट टीम मैं जस्ट आपको सेंसिटाइज करना चाहता हूं बिकॉज ये फोरम सही है, आप सब लोग प्रेजेंट हो यहाँ पे। प्लीज ऑल्सो डू चेक फॉर ज़ैलेटैन, ओके? ज़ैलेटैन एक ऐसा ब्रांड है जो पहले फाइजर पूरी तरीके से देख रहा था, अब माइलैन भी देख रहा है। माइलैन का नाम आप लोग ने सुना होगा, इट्स अ बैंगलोर बेस्ड कंपनी, ओके? माइलैन इज वेरी मच फोकस्ड ऑन ज़ैलेटैन नाउ। अगर आप 5 साल का हिस्ट्री में आपको बताओ, जो लोग ऑफ्थल मार्केट में ऑलरेडी है 5 साल से ज्यादा, ज़ैलेटैन पहले फाइजर के पास था। ज़ैलेटैन को लेके फाइजर इतना ज्यादा फोकस में नहीं था, इतना ज्यादा ध्यान नहीं दे रहा था, लेकिन जब से 2 साल से, जब से माइलन के पास